So we continue with the horizontal analysis. We reviewed the dental horizontal plane. Now we're going to focus on the teeth. Now we're jumping even further beyond the lips, focusing straight on the teeth. And this is where these lines come in. There's a few lines, and we're going to go one line at a time to evaluate how the teeth are in relations to each other. So we begin with this picture, which shows the ideal soft tissue and teeth positioning. And we have a lot of lines. Let's focus one line at a time, and then this picture will make sense. We're going to be focusing on line number 1. Now, if you take a quick look in our analysis, we went through all of this. We're now going to add to this zone right over here our ideal soft tissue and teeth position. Soft tissue means how the gums are in relation to each other and what symmetry we have, and how the teeth position is in relation to each other without having to focus too much now on the face or the lips. Now, moving forward, we want the ideal incisal edge position of the front 2 teeth and the sharp 2 teeth to be on one plane. If you could see this one line that goes across, and we want the 2 side teeth, the lateral teeth, to be slightly away from there. That's our line number 1. And if we take a quick look at Sandra's line, we could see that her sharp teeth are almost there, but her 2 front teeth, they're really low. And if we remember how we looked at her lips, these teeth were touching the lower bottom of the lip. So that means we could push these teeth in a little bit. And this is the lateral. It's in the ideal position. It should be slightly away from the line where these old teeth are supposed to be on. And this one maybe needs to be pushed up a little bit, or later on we'll reduce it to create symmetry. And this is how it should look, where if we draw a line, ideally her left side looks better than her right side, but this front tooth needs to be shifted up to match up with the sharp tooth, these two, the central and the canine, and the lateral, the side tooth, is in a good position. And on the other side, this tooth needs to be shifted in a hair also, as it's beyond the line, and we need to make sure that the lateral is pushed up a little bit and the canine. Now ideally this is the ideal position. Obviously with Sandra's, it may not work 100%, but if we could get her to 90%, that'd be great. As we could see, this tooth is pretty short and this one's pretty long, unless we end up moving her teeth and then doing some gum tissue treatment and maybe doing some shortening of her teeth. Now, if we continue and we look at just the teeth, we could better see what's going on, and we would probably need to lower this a little bit and line the teeth up, but we are looking for this evaluation. And when we're doing her real evaluation with Invisalign, you guys will see how we're going to work our way out of this and try to get her a nice, beautiful smile. And we were looking at her midline before that it looked pretty good. We now see that there's a gap. We're going to have to bring the teeth together, and we'll cover all of that when we're building her smile on the Invisalign program. Now, if we look further, the next line on our ideal soft tissue and teeth positioning is the top line, which connects the gum heights, and you could see that an ideal smile line, the soft tissue symmetry should be where the canines, the centrals, and the canines are the same, and the laterals are slightly lower. Just like they're higher on the bottom, they're slightly lower on top. And if we look at our analysis from the previous segment, previous course, we could see that the position of the laterals when it's at the height of the centrals and canines, these 2 front teeth and these sharp teeth, that's not aesthetic. And if it's above it, and if it's at the line, it's acceptable but not ideal. We want a more attractive approach. So for our patient, we're either going to go for acceptable or the more attractive, but no way for non-aesthetic. And in this case, we already have the tooth at this position. Here's an overview on how it should look. And here you could see that slightly things need to be adjusted. Maybe this brought in a little bit, or maybe this one brought in slowly, but you'll see when we do the analysis that it's important to create as ideal as possible, acceptable or ideal position. So now we covered the lower position of the teeth, on the top and the gum position. Now let's go look at what we need to do. Here's a quick error just to demonstrate that ideally we would want the gum to be lower here, and we would want these two teeth to be shifted up. And the same thing if we were to look at it without the lower teeth. Here we see the lower teeth, here's without the teeth. We have the same overview. Now if we're continuing, we did the top teeth analysis. We did number 1, we did number 2, we did number 3. Now we're going to number 4. And number 4 is how the 4 lower teeth, the gums have to match. And if we look at Sandra after we evaluated 1, 2, and 3 lines, and we saw the with the teeth and the just the upper teeth without the lowers. Now, if we're looking at the bottom teeth, we could see that the bottom teeth, they're all like skewing up. And if we look to the sharp canines, this is the one that's closest. So we want to bring everything into the zone as close as possible so that they match. Or maybe slightly higher here and then bring all of these. Maybe take the line of the top tooth and take the line of the lower tooth and do an average. So some of the teeth will need to go down and some of the teeth will need to rise up to match up a midline. The next line that we look up is number 5. But before we get to 5, here's a view of how the teeth look without the upper teeth. And we could see that this line here, it's a better view, that if we bring these down a hair, we could create that ideal symmetry where all the front 4 teeth have to align. And if you look at the canines here, that's line number 5, the canines or the sharp teeth, they do line up. So that's pretty good. And the final evaluation would be number 6 and then number 7. Number 6 and 7. So right over here, this is 6 and this is 7. We could see that the front, if we bring these down, all we need to make sure we align the edges of the teeth and the canine should be on the same height. So if we look carefully, all we need to do is just watch this chart and just go one number at a time to make sure we build out the perfect smile for Sandra or anyone else.